Hello, this is clinical reflection number 8, and today was a good day. Today, once again, I learned a lot. We did have some of the same patients. We did have one new patient who came in. He was a transfer from the Riverside location. So it was a 76-year-old male. He came over for AKI. He needed to see our urologist regarding like surgery procedures, and he needed to see our nephrology as well. He also has like a history of a lot. He has a history of bladder cancer, a nephrostomy. So what was also interesting about him was he had a nephrostomy bag placed, and we would have to go in and drain it because it would fill up pretty quick. He also has throat cancer, and he had to get a peg tube for that. He also has a history of AFib, hypertension, hyperlipidemia, chronic kidney stage 3 as well, liver cirrhosis, hypothyroidism. So we did have to administer him some levothyroxine, and that was always like administered early in the morning for him before breakfast. Um, and he's also has like chronic back pain um, with narcotic dependency. So he was a handful, but it was interesting to get to talk to him and know more about his diagnosis. We did have to go in his rooms a lot because he was Q4 vitals, and then also to drain that bag and just to get an update from him on how he's feeling and how things are going. The main concern for him was also just making sure the bag was being drained properly. You know, making sure there's no risk for infection. He was also on fall precautions. We also wanted to manage his pain as well, so he was prescribed medication for pain. So the main measures for him was getting him ready for possibly a procedure, because the very next day is when he's going to speak to our urology about moving forward and seeing how things are going to be at the moment. He did come in with low blood pressure as well. We're just stating that it may be due to all the moving around or all the commotion going on. But he came in with a blood pressure of 99 over 45, and it would kind of sat lower than that. So we would give him a bolus for fluids to help increase that blood pressure to help him out. Something interesting today was I got to see my nurse insert a straight catheter on a confused elderly patient. She hasn't been urinating for some time, so that was a concern. It's been a couple of days, so she had to get a straight catheter in place, but the thing is she was confused, so she was non-compliant for the most of the part, most of the time. So it was a lot going on. It did have we did have to have some people come in to hold her down, um, just to be able to talk with her nicely and maybe let her know exactly what's going on to try and reorientate her, to know exactly what's going on with her and why we have to insert a straight catheter. When she was in the position face forward, the regular position laid back, like the Fowler's position, we were kind of unable to get that position. So my nurse recommended turning her on the side, and she said maybe it was the angle of where the spot was, so she was able to go in that way instead. Something else I also learned about the straight catheterization, if you do go in on the wrong location the first time, leave that catheter in, so you can mark that spot. So when you do try again, you're not going in that same area. It's kind of like a spot marker, so you're not re-entering it into that same area, and that can cause pain in the patient. So, and it takes a lot of guidance to be able to make sure you insert it properly. So that was interesting to see and learn more about. So we did eventually get that. The patient eventually did calm down and got compliant and mildly understood why that was needed. So that was a good part of the day as well. Her family did leave, so just once again providing compassionate care by speaking with her, talking to her, keeping her comfortable, and just maybe creating distractions due to her being hospitalized. So she's not necessarily, like in the place that she is. Maybe that's causing her to be disoriented or a little confused. Um, But today was overall a good day. I learned a lot. And yes, thank you.